The silent signals. How your body warns you of a stroke weeks in advance. Have you ever heard someone say, "It happened so suddenly, no warning at all"? That's what many people believe about strokes. But here's something most doctors now agree on. Your body often gives you quiet signals long before a stroke happens. You just need to know how to listen. This video is especially for seniors, caregivers, or anyone over 60 who wants to stay safe and aware. In this 3-part series, we'll walk you through the 6 early warning signs your body might give you weeks, or even a month, before a stroke. These symptoms can appear quietly and seem unrelated. But if you notice one or more of these happening together, it may be your body calling for help. Let's start with the basics. A stroke happens when the blood flow to your brain is blocked, either by a clot or by bleeding. Without enough oxygen, your brain cells begin to die within minutes. That's why it's often called a brain attack. It can lead to paralysis, speech problems, memory loss, or even death. But here's the good news. If you recognize the signs early, you can take action and possibly prevent a major stroke before it happens. So what are these warning signs your body gives you ahead of time? Let's talk about the first one. 1. Sudden, unexplained fatigue, even without activity. If you've been feeling unusually tired for no clear reason, the kind of exhaustion that doesn't go away with rest, this might be more than just age. Fatigue is one of the earliest signs of poor circulation to the brain. Stroke-related fatigue often creeps in slowly, weeks before the actual event. You may feel drained after simple tasks like brushing your hair or making tea. Some people even describe it as a heaviness in their body or limbs. This happens because your brain isn't getting the blood and oxygen it needs, even before a stroke hits. If this new tiredness shows up suddenly and lingers for days or weeks, it's not something to ignore, especially if you're also at risk for high blood pressure, diabetes, or heart disease. 2. Blurred vision or sudden trouble seeing ****. The second early warning sign is something many people brush off: changes in vision. This may include blurred vision, double vision, or seeing dark spots. It might happen in one eye or both. You may even find yourself suddenly unable to focus on printed words, or bumping into things you normally wouldn't. The brain controls your vision, and if blood flow is blocked in the visual processing areas, even briefly, your eyes will tell you something is wrong. These vision issues can come and go. But if they appear out of nowhere, and especially if they're paired with dizziness or confusion, you should speak to a doctor immediately. This could be your body trying to protect you from a coming stroke. 3. Trouble speaking or forgetting words ***. Imagine sitting at the dinner table, knowing what you want to say, but the right words just won't come out. Or maybe someone points out that you're slurring your speech, even though you feel fine. This might seem minor at first, but it can be a powerful red flag. Speech trouble is a sign that your brain's language center is not receiving enough oxygen. And while this is commonly seen during an actual stroke, it can also appear days or weeks before as a warning. Some seniors report brain fog, pausing mid-sentence, or using the wrong words entirely. If this starts happening out of the blue, don't assume it's just aging. Your brain may be telling you something serious. Stay tuned for part 2. So far, we've looked at 3 critical signs: fatigue, vision changes, and speech problems. Each of these can appear quietly, and by themselves, they might not raise alarm. But together, they form a pattern that should not be ignored. In part 2, we'll uncover 3 more warning signs, including numbness, balance issues, and unusual headaches, and we'll explain what to do if you notice any combination of these signs in yourself or a loved one. Because when it comes to stroke, time lost is brain lost. ***, but if you can listen to your body in advance, you just might save your life, or someone else. More early warnings. The last clues before a stroke strikes. Welcome back. In part 1, we uncovered 3 of the most overlooked early stroke warnings: unexplained fatigue, vision problems, and sudden speech issues. If you haven't watched that part, be sure to check it out after this video. These quiet symptoms can appear weeks before a major stroke, and recognizing them in time could save your life. Now in part 2, we'll cover the remaining 3 powerful warning signs that often show up before a stroke strikes. Again, these signs may seem small, random, or harmless. But when you know what to look for, you can respond faster, and get the help you need before things get serious. Let's jump right in. 4. Sudden numbness or tingling, especially on one side of the body ***. Have you ever felt a strange tingling in your arm or leg that comes and goes for no clear reason? Or maybe a hand, foot, or even your face felt suddenly numb, like it had fallen asleep without pressure? These are not always harmless. One-sided numbness or tingling is one of the classic stroke warnings, and it doesn't always show up as a dramatic event. Sometimes, it begins quietly, days or even weeks before a full-blown stroke. It may start with a slight weakness in your grip, a foot that drags just a bit, or a face that feels slightly different on one side. These symptoms happen because part of your brain, usually the side controlling movement and touch, isn't getting enough blood. What makes this dangerous is that people often ignore it. They assume it's just age, arthritis, or sleeping in a funny position. But if this happens suddenly, especially on one side of your body, don't wait. It could be your body waving a red flag. 5. Loss of balance, dizziness, or trouble walking. Have you ever felt unsteady on your feet, like the room is tilting or spinning, even when you're standing still? Dizziness, balance problems, or unexplained falls can all be early signs of a stroke ***, especially when there's no clear reason, like medication or dehydration. Some seniors describe this as feeling off, like their body isn't quite cooperating. They may suddenly walk sideways, feel wobbly when standing up, or reach for furniture to steady themselves. This happens when the part of the brain that controls movement, coordination, or the inner ear is affected by reduced blood flow. It's very common to brush this off as just getting older. But here's the thing, if your balance was fine last week and now you're stumbling or needing support, your body is trying to warn you. Don't ignore sudden changes, especially if they come with other symptoms like blurred vision or slurred speech. 6. Unusual, sudden headaches, especially with no history. Everyone gets the occasional headache, but a sudden, intense headache that comes out of nowhere, especially if you're not someone who gets headaches often, is one of the final signs that a stroke could be near. In fact, many stroke survivors say they experienced a strange headache days or hours before the event, sometimes with neck pain or visual auras. This headache may feel different from what you've ever had before. It can be sharp, pounding, or even feel like pressure building inside your head. Some describe it as a lightning bolt or a balloon expanding in the skull. If this happens to you, and especially if it comes with confusion, weakness, or dizziness, call for help immediately. This type of headache is often caused by bleeding in or around the brain, known as a hemorrhagic stroke. And while this is less common than a clot-based stroke, it's more deadly. That's why catching it early is critical. What to do if you notice these signs? Now that you know all 6 early stroke warnings, fatigue, vision changes, speech trouble, numbness, balance problems, and unusual headaches, the next step is knowing how to respond. Here's what doctors recommend. 1. Don't ignore it. Even if symptoms come and go, even if you feel mostly fine, take them seriously. 2. Write it down. Note the date, time, and details of each symptom. This helps doctors assess your risk. 3. See your doctor immediately. Ask for a stroke risk screening, especially if you have high blood pressure, diabetes, or a history of strokes in your family. 4. Call emergency services if multiple symptoms happen at once, especially numbness, slurred speech, or balance loss. Don't wait for it to pass. You may not be able to stop every stroke, but knowing the signs puts power back in your hands. Many strokes are preventable if the warnings are caught early. And many lives have been saved because someone trusted their instincts, asked questions, and got help in time. In Part 3, we'll go one step further, exploring how to reduce your stroke risk after 60, and what daily habits protect your brain and body. You'll learn what to eat, what to watch for, and what to avoid to keep your blood vessels healthy, all in simple steps that anyone can follow. Because prevention isn't just possible, it's powerful. Don't miss these 6 stroke warnings. Your body tells you in advance. This final part focuses on how seniors can reduce stroke risk naturally, with clear, practical lifestyle habits for brain and heart health. Protecting yourself from stroke. Simple habits that could save your life. Welcome to the final part of our Stroke Awareness series. In Parts 1 and 2, we uncovered 6 early warning signs your body may give you weeks before a stroke. These included fatigue, vision changes, speech problems, numbness, dizziness, and sudden headaches. But now that you know what to look for, here's the most important step: protecting yourself before it ever happens. The truth is, most strokes don't strike without warning, and they're not just a part of aging. In fact, the majority of strokes are preventable. That means with just a few simple changes to your daily habits, you can cut your risk of stroke dramatically, and give your brain the support it needs to stay healthy well into your 70s, 80s, and beyond. Let's explore the everyday actions that can keep your brain safe and strong. 1. Control your blood pressure, the #1 stroke risk factor. If there's only one thing you do after watching this video, let it be this. Get your blood pressure checked, regularly. High blood pressure is the single most dangerous risk factor for stroke. It damages your blood vessels quietly over time, until one day, a clot forms or a vessel bursts, and a stroke happens. If your blood pressure is consistently above 130/80, talk to your doctor. You may need lifestyle changes or medication to bring it down. Reducing salt, eating potassium-rich foods like bananas and leafy greens, staying active, and managing stress can all help. Checking your pressure weekly at home, with a simple wrist or arm cuff, can alert you to problems early. Don't wait until it's too late. 2. Keep your blood sugar and cholesterol in check. Diabetes and high cholesterol are two other major stroke risks. When sugar levels are too high, they damage blood vessels in your brain. And when cholesterol builds up, it creates dangerous blockages. You don't need to follow a complicated diet to improve these numbers. Just aim for simple, balanced meals. Whole grains, fresh vegetables, lean proteins like beans or fish, and healthy fats like olive oil or walnuts. Avoid fried foods, white bread, and sugary snacks. They may seem small, but daily choices matter more than once-a-month efforts. Ask your doctor to test your blood sugar and cholesterol once or twice a year, and if the numbers are high, don't panic. You have the power to change them, one bite at a time. 3. Move your body every day, even gently. You don't have to run marathons or lift heavy weights to protect your brain. Just 20 to 30 minutes of gentle movement every day helps keep your blood flowing, your heart strong, and your mind sharp. Walking, stretching, light yoga, or chair exercises can all work. Even gardening, housework, or dancing to music in your living room counts. The goal isn't to exhaust yourself, it's to get your body moving, your lungs breathing, and your circulation active. Regular movement helps lower blood pressure, balance your weight, reduce stress, and strengthen your arteries, all of which fight stroke risk. 4. Watch for atrial fibrillation and irregular heartbeat. Many seniors don't realize that a stroke can also come from the heart. A condition called atrial fibrillation, or AFib, causes your heartbeat to become irregular. When this happens, blood can pool in the heart and form clots, which then travel to the brain and cause a stroke. AFib doesn't always have symptoms, but some people feel fluttering in the chest, shortness of breath, or tiredness. If you've ever had an irregular pulse, even briefly, talk to your doctor. They may recommend a simple test or medication to manage it. You can check your pulse at home. Just gently press 2 fingers on your wrist or neck, and count the beats in 60 seconds. If it feels jumpy, irregular, or too fast, get it checked. 5. Quit smoking and reduce alcohol intake. If you smoke, now is the time to stop. Smoking narrows your blood vessels and increases clot formation, doubling your stroke risk. But the good news is, your risk starts going down the very day you quit. Within months, your blood pressure improves, your lungs heal, and your body begins repairing itself. Alcohol in small amounts may not be harmful, but drinking heavily can increase blood pressure and weaken your heart. Try to limit it to 1 drink a day, or skip it entirely, especially if you're on medication or have other health issues. Remember, it's never too late to make a change, and even small steps lead to powerful results. 6. Manage stress and get enough sleep. Long-term stress takes a toll on your body, especially your heart and brain. That's why managing stress is just as important as managing your diet. Try breathing exercises, prayer, meditation, gentle music, or talking with someone you trust. Even a quiet walk or 10 minutes in the garden can calm your nervous system. Sleep is another pillar of stroke prevention. Aim for 7 to 9 hours of sleep each night. Poor sleep raises blood pressure, affects memory, and increases stroke risk. Create a bedtime routine, avoid screens before sleep, keep your room quiet and dark, and relax your mind before lying down. You've earned peace. Let yourself rest well. Final thoughts. Your life matters, and so does prevention. If you're over 60 and watching this, you've likely lived through many storms, joys, and lessons. You may have lost friends or faced illness. But here's what's still true: your life matters. Your health matters. And your brain deserves your care. Stroke doesn't have to be your story, and even if you've had a small one before, you can still protect yourself from the next. By listening to your body, spotting the early signs, and making small daily choices, you take back control. And that's a powerful, beautiful thing. So please, share this video with someone you love. Talk to your doctor if you've noticed any warning signs. And know this: prevention is not about fear. It's about loving yourself enough to stay well. Here at Eldering Wisdom, we believe that aging can be strong, wise, and beautiful, and we're here to walk beside you every step of the way. Thank you for watching. Stay safe, stay informed, and stay empowered.